In Wilson disease, best choice of investigation is serum copper level, urine copper level, ceruloplasmin level in the serum, and hepatic copper estimation. So first we need to understand about the Wilson disease. This is an autosomal recessive disorder also known as hepatolenticular degeneration and historically known as Westphal-Strumpel disease or Westphal pseudosclerosis. Pathogenesis involved in Wilson disease is mutation of ATP7V gene, which is responsible or encoding the copper transporting ATPase on the hepatocyte. Mutation of ATP7B gene result into the decreased transport of the copper from hepatocyte to plasma, decreased ceruloplasmin level. Ceruloplasmin is a copper binding, copper transporting protein into the in plasma. Decreased copper secretion in the blood, as there is no copper comes out from the hepatocyte, or increase or accumulation of copper into the hepatocyte. All these will result into the hepatic injury via free radicals displacing other metals as the copper accumulate inside the cell, and binding of copper with the sulfhydryl group of the cellular protein ultimately result into this hepatic cell injury. Clinical features commonly seen in Wilson disease: in the liver there will be jaundice, hepatitis, in some cases sudden acute liver failure, and Coombs negative hemolytic anemia. Due to accumulation of copper in basal ganglia or putamen, there can be tremors, ataxia, drooling, dystonia, and in some cases Parkinsonism may also result. On slit lamp examination of the eye, a classical finding of golden brown or greenish brown ring around the iris, which is known as KF ring or Kasher-Fleischer ring, also seen. On diagnosis, serum ceruloplasmin is the investigation of choice. Level of serum ceruloplasmin is very low in Wilson disease, less than 0.2 gram per liter. Gold standard investigation or best investigation for the diagnosis of Wilson disease is quantitative hepatic copper concentration on liver biopsy more than 250 microgram per gram dry weight of the liver. Stains used for copper to stain copper are rhodamin and orcine stain. In ambiguity of biochemical test, we can use genetic testing for ATP7V gene mutation, which is very specific. So to answer this question, what is the investigation of choice in Wilson disease? So our answer is serum ceruloplasmin level. Urine copper concentration can also be used as a test for initial diagnosis. Serum copper is not very reliable, as most of the serum copper is attached or bind with the serum ceruloplasmin. So serum ceruloplasmin is the more reliable investigation, and hepatic copper estimation is the gold standard or best test for the diagnosis of Wilson disease.